Hi, I'm Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, perinatal mental health certified, and maternal newborn nursing certified. Many women will have complications during their pregnancy and be told they need bed rest. Today we'll be talking about everything you need to know about bed rest and how to keep your baby safe. So click those like and subscribe buttons and stay with us. Okay, so your doctor told you need bed rest, but what activity is actually allowed? Bed rest looks very different for everyone. And actually, there's no evidence that shows that bed rest really works, which is why your bed rest may look differently than what you imagine. You need to talk to your doctor and find out what you're allowed to do. For example, you don't want to be laying in bed all day long. That's not good for you. So ask how often you can switch from a chair to a bed and vice versa. Ask if you're allowed to go to the store, but most likely you'll need to use a wheelchair when you're doing so. Ask about light chores. Believe it or not, you may be able to do small things in your house even while on bed rest. Some women are allowed to walk. Some women are allowed to have sex. Again, these are things that you need to talk with your healthcare provider. Sometimes sex may look like regular vaginal intercourse, but nothing else. Sometimes you're only allowed to have an orgasm, such as through masturbation. Ask if you're allowed to drive. A lot of women who are on bed rest are still allowed to, say, drive to their other child's school to pick them up. When you're standing in your house, you need to find out how long you are allowed to stand for. I usually tell patients no more than 30 minutes because, again, you're supposed to be resting. And finally, if you have stairs in your house, you need to plan for these because you're not going to be able to walk up and down your stairs multiple times per day. There are some risks associated with bed rest that you should be aware of. Some of the risks include developing pneumonia, blood clots, reduced muscle mass, which may affect pushing, increased weight gain, diabetes, insomnia, and bone loss because you're no longer performing any weight-bearing exercise. Be sure to talk to your healthcare provider about these. Okay. So when you're on bed rest, you're not moving that much. So one of the biggest complications or risk factors is constipation. This is very common. So you want to try to prevent that as best as you can. Ask your healthcare provider if you can start taking Colace every day. Colace is a stool softener, it's not a laxative, and it can help you to stay regular. Also consider adding fiber to your diet. You want to also limit the time trying to go to the bathroom. You know, in the hospital, we tell women to wait until they know they have to go to the bathroom. You cannot sit on the toilet when you're on bed rest because that can actually increase your risk of dilating. Laxatives should not be used unless your healthcare provider has told you it's safe to do so. Please remember to hit the like button and subscribe so you can get our latest content. Okay, now let's talk about hydration and nutrition. Let's start with hydration. Hydration is drinking. Everybody's heard you need to drink lots of water, okay? But it's very important during pregnancy because dehydration can cause preterm labor and contractions. If you're on bed rest, likely this is already a risk that you're experiencing. So one of the things I recommend is you buy several water bottles. You're on bed rest. You should not be getting up and down several times a day in order to fill your water bottles. So get 4 or 5 that you can keep by your side. Next, as far as nutrition goes, you shouldn't be standing up to prepare big meals. So make sure your family packs you a cooler that you can keep right next to you in the morning. Make sure that cooler has plenty of nutritious snacks and possibly even your lunch already made in advance. It's okay during this time if you're going to have to utilize other ways to eat, like takeout. A lot of people feel really bad about this. They think they should be making all these homemade meals, but really the most important thing is taking care of yourself. If your friends and family offer to cook you meals, please take advantage of this. They want to help you, and this keeps you off your feet. Make sure you're taking your prenatal vitamin, which can fill in any nutrients that you may or may not be receiving at this time. And you want to make sure you're avoiding high sugar foods. Carbohydrates and especially artificial sugars can lead to diabetes, which is another life-threatening complication for you and your baby. Just because you're on bed rest doesn't mean you can't exercise. There are some things that you can do even while sitting on your couch. Ask your healthcare provider about whether you can do ankle rolls or knee bends. Talk to them about using an incentive spirometer, which is a device that helps you expand your lungs to prevent pneumonia. Remember those Kegel exercises to keep your pelvic muscles nice and strong for labor and delivery. Arm lifts and arm and feet circles can also help. Squeezing stress balls can help tighten and tone your forearms and your hands. Tensing your arm and leg muscles can be done without even moving. And finally, ask about whether you can push your arms and legs against the foot of your bed. Make sure to talk to your healthcare provider about showering. So you can't assume when you're on bed rest that you can take a shower every day. It depends on what's going on with your pregnancy. So you need to ask, how often can I take a shower? Am I allowed to take a bath? Most likely the bath is a no. Okay, in addition, you can't assume that you can just stay in the shower as long as you want. Some providers will want you to only take a 5-minute shower, just enough to get cleaned off. So ask, 5 minutes, 10 minutes, make sure you know the guidelines. You need to avoid hot water. Hot water can stimulate the uterus and start contractions. You also need to find out, are you allowed to stand in your shower, or should you get a stool that you can sit in when you're bathing? And finally, remember that you're on bed rest, so once you're out of the shower, you can't spend an additional 20 minutes brushing your teeth, combing your hair, and all that other stuff. You need to find a place to sit in order to do that. So bed rest can be very wearing on your mental health. So it's important not only to take care of your physical, but also your emotional needs. There's a lot of stress involved with bed rest, including issues with childcare, money, and household chores. Use your village. Your family and friends want to help you. Also, create a schedule and stick to the schedule. It's very hard when you have so much time on your hands, but if you know exactly what you're going to do throughout the day, it can help keep your day moving. Be sure to engage in activities for your mind. Puzzles, game, art. Look online for volunteer opportunities that you can do completely online. Make sure to plan visits with your friends. Don't just wing it. You want to ask them to come over at regular times. And don't have friends all come over in one day. Have them spread it out. You can also find support groups online. These support groups can help you feel like you're not alone. They give you social interaction, and they make sure that you are doing something. Remember, you need to do something. Finally, since you have lots of time on your hands and you're doing everything you can to protect that baby, plan for your baby. Help be involved in the planning of your baby shower, work on the nursery, even start a baby book for your baby. These are all wonderful things that you can do to keep yourself busy and keep yourself happy. So in the end, bed rest is all about planning. If you live on 2 floors, you may want to get a cart or a table that you have supplies on each floor ready for you. Be sure to plan ahead. You want to make sure in the morning you have everything you need. Extra pillows, a blanket, chargers for your phone and computer, comb, brush. You want to have extra clothes in case you need them, a sweater if you get cold. Make sure you have all of the activities you're going to plan to do, those games, art, reading materials. Make sure you have remote controls close, and believe it or not, bring extra batteries. Then make sure you also have some of those luxury items like lip balm, pen, paper, tissues. The point is to make sure you have everything you need so that when you are getting up, your journeys are short in time. I hope you have learned everything you wanted to know about bed rest during your pregnancy. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe buttons so you can learn the latest in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.